So we finished treating John, and the first thing that we did for him was we placed this 2-inch foam underneath each trochanter, and it put pressure on all the hip rotators. We did that on both sides for 5 minutes. And now I can rotate him to 30 degrees with a softer end feel. So he was 10 degrees prior to that. So we made a distinct difference in hip rotation. And then for the posterior pubic bone on the left, we took this firm foam again and we placed it under the ischium. And so that glided that left pube into anterior rotation and restored normal movement. We then had him hug his right knee. Go ahead and hug it outside your shoulder. And we did that for 2 minutes. So the knee is pointing outside the right shoulder. And that was 2 minutes. And go ahead and put it down. And in doing these treatments, we also restored posterior mobility of the right ilium. I can now take up the slack to a natural stop, and then with about the same amount of force again, we get a little bit of spring mobility and recoil, and I see his heel move. I see the movement goes down through the lower extremity. So now that movement does go through the sacroiliac joint and down into the hip and lower extremity. So he now lays with much improved symmetry of the anterior pelvis. And earlier he was really tight on the external obliques on the right, and now that's much more relaxed. The pubic bone, is there any reduction in tenderness?
Maybe a little.
Okay. And what about out near the canal?
Well, yeah, a little bit more.
A little bit of less soft tissue tenderness?
Mm-hmm. Yep,
okay.
correct.
And the lower pubic bone is now symmetrical. So you no longer present with that rotation. And you also no longer are stuck in terms of side glide. I can now take up the slack going left to right, and I can then spring it, and there's give. Lay on your stomach. So your left ischium, I can now take up the slack and I can spring it. The right ilium. The right ilium did not glide inferiorly. I can take up the slack, I see your feet move, and I can spring it and I see movement down low. So that's improved. Now, he has a little bit of developmental asymmetry. It's really subtle, but there's a little bit of improvement, but only a little in terms of symmetry of the medial aspect of his sit bones and the midline, the gluteal crease in the middle. Okay? So we didn't quite achieve symmetry there. We got some improvement. And so developmentally, he has this asymmetry and he will always have it. It's not treatable with stretching or mobilization. And we did gain mobility. So now I can take up the slack going medially and I can spring that. And then we come to the other side and we take up the slack and then we can spring that. And going medially, we can take up the slack now and spring it. And on this side, we take up the slack and we spring it. Typically, the coccyx is side bent with that pattern, but I did not see it before and I do not see it now. So in response to this treatment, we restored movement in several directions and we improved symmetry, improved hip range of motion, and he feels like when he sits, he's sitting more squarely. What pleases me especially is that we have reduced tenderness at the inguinal canal, at the region of the inguinal canal, and overline the pubic joints. Now he did stand up after all this treatment, and he felt a tightness in the region of the inguinal canal, obturator muscle, when he arched backwards. So we had him do 30 backward bends, and that made a difference. It seemed to lessen that tightness. And so this is an example of a complex pattern of multiple pelvic asymmetries and hypomobilities in multiple directions, coupled with soft tissue discomfort and with a positive response to treatment. Thank you.